we know that CAR T cells right now are an amazing option for patients with relapsed refractory disease, but we still see that many of these patients relapse within the first 2 years, and we don't really know all of the reasons behind these relapses. And we have tried to use PET scan, which is a tool that we have had readily available for the last years, especially in the newly diagnosed patients where we know its utility. So we wanted to explore whether using the PET CT would be useful for these patients. And we found that it is good, especially in the basal scans, for detecting the extramedullary disease. We have found that extramedullary disease is perhaps the factor that influences the most in this regard. For some reason, these patients don't fare as well as others. And furthermore, we found that if the patient persists with paramedullary disease after the treatment with CAR T cells, paramedullary disease becomes a negative factor for them. They have a much poorer survival than the rest. And this is interesting because paramedullary disease had not been something relevant before. Another important finding is that the focal lesions that have been very contested along the years in myeloma, we found that the persistence of hypermetabolic focal lesions at 3 months had a tendency to worse outcomes. These patients had a tendency to worse progression-free survival and a tendency towards a worse overall survival. But you don't have to be too hasty, because sometimes you do a PET scan after 1 month and then you find that there are still many focal lesions with high metabolic uptakes. Those do not have that impact. So if you still see them 1 month after the treatment, you shouldn't be too worried. You should wait until 3 months. That appears to be the best time for reassessing the patients.